Welcome, everyone. Good afternoon, and thank you for joining us today. Um, ca- I think everyone can hear me. So I'm Nivi Patel. I'm the primary care lead for social prescribing at CCHOHT and hospitalist working at the Oakville Trafalgar Memorial Hospital. I'm excited to welcome all of you to today's Lifestyle Medicine and Social Prescribing webinar. This is a bi-monthly webinar initiative designed to support all of us in primary care with evidence-based practical approaches to incorporating lifestyle medicine into our practice while addressing social aspects of caring for patients. We're delighted to welcome Dr. Zara Kassam, who will be speaking on integrating lifestyle medicine into cancer care today. In this session, she will explore how nutrition, physical activity, and other healthy lifestyle practices can support patients living with and beyond cancer. She'll share practical recommendations and resources to help patients make meaningful lifestyle changes while also highlighting opportunities for healthcare professionals to continue learning in this evolving area of care. Dr. Zara Kassam is a radiation oncologist at the Stronach Regional Cancer Center and assistant professor at the University of Toronto. Certified in lifestyle medicine, she co-chairs the Canadian Lifestyle Medicine Group of the American College of Lifestyle Medicine. She is the co-founder of Plant-Based Canada, a nonprofit advancing evidence-based plant-based nutrition for human and planetary health. Dr. Kassam is the co-author of Eating Plant-Based and co-editor of Plant-Based Nutrition in Clinical Practice and promotes sustainable food systems through her roles in national healthcare organizations. Welcome, Dr. Kassam, and thank you so much for taking time out of your very busy schedule to be here with us. Before we get started, just a few housekeeping points. It would be great if you could all mute yourself. I think we actually maybe by default have everyone muted, just so we can minimize background noise. And I'd ask if you could add your questions to the chat or ask questions at the end. We will have time reserved for it then. There will also be a brief evaluation form in the chat, and we would love if you could kindly fill that out as well. The session is accredited for one main pro credit, and you will get a certificate emailed to you after the session. Thanks again for being here, and I'll turn it over to Dr. Kassam.
Thank you so much for this invitation to be here to talk about my favorite subject. I'll go a little fast. Apologies for the delay again. So we will talk about integrating lifestyle medicine into cancer care. We'll review some evidence, opportunities, and practical resources. So my disclosures, Nivi has gone through them already, but in addition, I'm founder director of the nonprofit Plant-Based Canada. The royalties from my 2 books go into this. And I'm also advisor to Plant-Based Treaty, Animal Alliance of Canada, and the Animal Law Programme at U of T. Today's objectives will be to review some of the cancer statistics, to review the role of nutrition and physical activity in cancer care, where most of the evidence in lifestyle behaviour is. We'll discuss some common lifestyle recommendations for people living with and beyond cancer. And at the end, I'll share some resources that can support patients in making healthy lifestyle changes, as well as some resources for further professional learning for us as healthcare professionals. We all know the heavy burden of cancer. 15% of all deaths globally is from cancer. In Canada, the latest statistics are that 2 in 5 Canadians will develop cancer in their lifetimes, and 1 in 4 will die of it. It is in fact the leading cause of death in Canada, accounting for 31% of all deaths, and it is by far the leading cause of premature death in Canada. We know that lung, colorectal, breast, and prostate cancer account for about half of all cancer diagnoses and deaths, and this is where most of the literature is. We also know that only 5 to 10% of cases are familial due to the genes that we are born with, and it is estimated that 40 to 50% of all cancers are preventable through modifiable lifestyle behaviors. The worrying aspect of cancer risk now is that we're seeing more and more younger patients with a diagnosis of cancer. I'm sure you're seeing this in your clinics as I'm seeing it in mine. So we have evidence that over the past few decades, the incidence of early onset cancer defined as under the age of 50 is increasing in about 14 different types of cancers, including some of our most common ones. We also know that if you have a diagnosis of cancer, there is an increased risk of developing a second cancer and then dying of that second cancer. And that really tells us that we are not addressing some of the root causes of the development of cancer in the first place. We also know that the treatments themselves can cause other problems to deal with in our cancer survivors. Fatty liver disease is linked to chemotherapy and endocrine therapies, cardiovascular disease to chemo, radiation, and immunotherapies. Second malignancies are increased due to cancer therapies. We have side effects such as cognitive impairment from treatments. We have an increased risk of metabolic syndrome, and that's also independent of these cancer therapies, and also bone health issues. So a huge burden with respect not only for the diagnosis of cancer itself, but the sequelae of the cancer treatments. I'm going to just spend a minute or so talking about the underlying mechanisms of disease. We know that lifestyle approaches can address the root cause of disease. We can think about chronic diseases as having common pathophysiological processes. And this graphic from the lifestyle medicine literature is fantastic, and I think really embodies what disease is currently in our communities. So the three pathophysiological processes include microbiome alterations, epigenetic changes, cellular stress, and injury. And these each cause inflammation, which then feeds back and causes more of those pathological processes. Unhealthy lifestyle behaviors cause the negative aspects in these processes. But the good news is then that healthy lifestyle behaviors can positively impact these processes. When these processes go on in our body, they manifest with different diseases, obesity, type 2 diabetes, cardiovascular disease, cancer, depression, as well as other chronic diseases. And this makes sense then if we think about all the diseases having common pathological features, common root causes. The cancer literature reflects this. This is a review paper. So as oncologists, we are asked to read this. This is the hallmarks of cancer. This was updated in 2022. It's written by the great Dr. Hallahan. And it talks about 8 hallmark capabilities of cells to develop into cancer with enabling characteristics. And currently there are 2, but there are proposed additional ones. But you can see similar physiological processes going on here: genome instability, tumor promoting inflammation, epigenetic changes, and polymorphic microbiome. I'm going to talk first about plant-based nutrition, where most of the evidence is. In terms of cancer incidence, we have a lot of evidence supporting that. And we'll take a moment to talk about what we think is a healthy diet. And we really do have decades of evidence supporting that the most healthful diet is plant-based, where the majority of your nutrients, the majority of your diet comes from plant-based foods. It does not have to mean 100%. It doesn't have to be vegetarian or vegan, but it's mainly, if we look at the literature, we can say it's at least 85%. So centered around the plant foods and low in saturated fat, the fat from animal products. And therefore it can be a variety of dietary patterns which are culturally adaptable. It can be the pescatarian, the Mediterranean, healthy omnivore diet, or a vegan and vegetarian diet. And it's great that this decades of evidence has now made its way into national and international consensus and our clinical guidelines, as well as our country-based guidelines. Plant-based diets are endorsed for disease prevention and first-line management of many of our chronic diseases. It's in the cancer guidelines now as well. So the guidelines that I talk to my patients about include the American Cancer Society guidelines, the World Cancer Research Fund, and American Institute for Cancer Research guidelines, updated most recently in 2025, which we'll talk about later. And the Canadian Cancer Society endorses the Canada Food Guide as the dietary pattern to follow. And as we know, the most recent update in 2019 is essentially a plant-based diet. It's great to see in the literature as well the articles that are coming out. This is from 2022 by 2 oncologists from Memorial Sloan Kettering. It's a really great review to read if you want a gestalt of the data in this area. And the results of the review suggest that the collective evidence supports plant-enriched diets versus ketogenic diets for the reduction of cancer risk and the improvement of metabolic disorders in survivors, which is such a problem. And interestingly, there are more studies going on in ketogenic diets and cancer than there are in plant-based diets and cancer, which is opposite to what the literature actually shows as its benefit. Just this year, we've had 2 big reviews. I'm just going to highlight one of them. This was published just in March 2026, and it was a systematic review and meta-analysis of the prospective studies of vegan and vegetarian diets and cancer incidence. And it showed that vegetarian compared to non-vegetarians had a 13% reduced overall cancer risk, and this translated into a number of individual cancer risk reductions. If you were vegan, there was a 23% reduction in overall cancer risk, with the strongest evidence in breast cancer, showing a 20% reduced risk for breast cancer incidence. So the take-home message from this was that this review supports the recommendations of the international guidelines to adopt more plant-based diets for cancer prevention. When it comes to outcomes, plant-based nutrition impacts outcomes, not just incidence. This is the Global Burden of Disease study. It's a seminal study published in 2019, and they found that suboptimal diet was responsible for more deaths than any other risks globally, including tobacco, that improvement in diet could potentially prevent 1 in 5 deaths globally, translated to avoiding 11 million premature deaths per year. And they found that the leading causes of diet-related deaths were cardiovascular disease and cancer. And the top dietary risk factors were having too much sodium, so that's a reflection of our processed food intake, and too low an intake of whole grains, fruits, vegetables, nuts, and seeds, so all the plant foods. And if we actually look at the Canadian intake, we have good data from the Global Nutrition Report showing that only 23% of Canadians eat the recommended fruit and vegetable recommendations, and we are eating 200% of recommendations for red meat. So we really do have a lot of education to do. In terms of the individual studies, there are several studies. This is one of my favorite that I'd like to highlight. This is the impact, looking at the impact of 5 healthy lifestyle factors on life expectancies in the US population, published in 2018. And this was from Harvard. It's from the Nurses' Health Study cohort and Health Professionals Follow-Up Study cohort, looking at 170,000 men and women followed for about 30 years. And their lifestyle factors they looked at were alcohol, smoking, physical activity, weight, and a healthy diet. Now, the healthy diet, they scored based on their in-house alternate healthy eating index, where you got more points, better points for higher intake of fruits, vegetables, whole grains, unsaturated fats, and omega-3 fats, and higher, better points if you had a low intake of red meat, processed meat, sugar, sweetened beverages, trans fat, and salt. And they showed that you could reduce cancer mortality by 30% if you were eating in the top, if you were the most adherent to the alternate healthy eating index. And if you had all 5 factors, you reduced cancer mortality by 65%. And this was true, similar results for cardiovascular disease as well. The other interesting thing that they showed was that if you were following these 5 healthy lifestyle factors at the age of 50, you would live 12 years longer if you were male and 14 years longer if you were female. So eating well not only reduces your risk of disease, but increases years to your life. I highlight this study because this is one of the few randomized control studies done in diet and cancer. And this was a randomized control study looking at nearly 50,000 postmenopausal women followed for about 20 years. And the intervention group was asked to reduce their fat to a total of 20% of calories. This compares to about 32% of the non-intervention group. And they were asked to increase their fruits, vegetables, and whole grains as well. And in their follow-up, they found there was a 15% reduction in the risk of death after breast cancer and a 21% reduction in death from breast cancer, supporting the conclusion that a low-fat dietary pattern was associated with increased fruit, vegetable, and whole grain intake, significantly reduces the risk of death from breast cancer in postmenopausal women. We see similar studies, not a randomized control study, but in colorectal cancer, for example, here is a study, nearly 3,000 participants, showing that dietary patterns reflective of high intakes of plant foods and lower intakes of animal products before and after a colorectal diagnosis was associated with a longer survival. Here is a recent 2025 systematic review looking at prostate cancer, again, one of our commonest cancers, showing that more plant-based dietary patterns were associated with lower prostate cancer risk in the first place, and that if you had a diagnosis of prostate cancer, there was a reduced risk of prostate cancer progression and improved cancer-specific outcomes, highlighting the importance for us all to integrate dietary counseling into patient care, recognizing diet as a modifiable factor that can complement standard oncological treatments. And I wish we were following this in a better way in our cancer centers. No talk on cancer and nutrition would be complete without talking about Dean Ornish's study on prostate cancer as well. These are all small studies that were done a while ago, 1990s, 2000s, and into the 2010s. But he looked at patients with early prostate cancer. There were small groups, as I said, and he did randomized control studies looking at intensive lifestyle changes. And his intervention group had a vegan diet, social support, group counseling, and exercise. And they found that in this group of patients with early prostate cancer who are on active surveillance, they found at 1 year, the PSA in the control group went up, but the PSA on average in the intervention group went down. They also found that at 2 years, only 5% of the intervention group required intervention with surgery or radiation or hormones, compared to 27% in the control group. And he also did some small studies looking at some very interesting things. One study looked at telomerase activity. So for people with prostate cancer who underwent this intervention of intense lifestyle, their telomerase activity went up, their telomeres lengthened, and we know that's associated with better health. They also did prostate biopsies after 3 months of these interventions and found that there was upregulation and downregulation and changes in almost 500 gene transcripts associated with cancer development. So really interesting hypothesis generating studies showing that you can impact your disease progression, but also you can change your genes, you can change the length of your telomeres and expression of telomerase. So really fascinating studies. Quality of life, we know, is also very important, not just our survival, but how we live following a diagnosis of cancer. And we have some really interesting studies looking at that too. And this one is quite unique. This was looking at plant-based diets in patients who had undergone treatment for prostate cancer. And this was again from the Harvard group. They looked at 3,500 people who had non-metastatic prostate cancer who had been treated in the past. 48% of the group had radical prostatectomy, 35% radiation, and the median time to undertake the quality of life questionnaire was 7 years. And interestingly, a higher plant-based diet score was associated with better scores for sexual function, for urinary irritation and obstruction, urinary incontinence, for better scores on energy and depression and hot flashes, as well as sexual function. So this really was quite a unique study, and I think gives us additional fuel to be able to tell patients that we can actually improve some of the treatment-related side effects that they're experiencing. Here is a study in patients with metastatic breast cancer. This is a randomized control study looking at patients who were on stable systemic treatments, and their intervention was a whole food plant-based diet for 8 weeks. And they found that those people who were undergoing the intervention, the whole food plant-based diet, had improved perceived cognitive function and emotional well-being compared to the standard group, as well as improved fatigue levels. Similarly, they looked at weight and cardiometabolic and hormonal outcomes, and those in the whole food plant-based dietary group had lower weight after 8 weeks. They decreased their total cholesterol and their LDL as well. They improved their insulin resistance too. And we know, as we've said already, how these factors are problem in our cancer survivors as well. So small studies, short follow-up. It would be great to see longer follow-up on these kind of studies, but definitely very interesting. Now, what about during treatment? We do have some studies showing that what we do in terms of our lifestyle during cancer treatment can impact our response to treatment as well. And here is one really interesting study from 2023. It's a randomized control study of 173 women who had stage 1 to 3 breast cancer undergoing neoadjuvant chemotherapy. And the intervention group was asked to do a home-based exercise program and a nutrition intervention, which was described as predominantly plant-based. And those who are undertaking the intervention had an improved pathological complete response rate from 28% to 53%. And this is so important because we know that people who have a pathological complete response rate, they do better in terms of their survival. So again, this is something, I start talking to my patients about diet before and during their treatment. I don't wait till afterwards, which is what some people choose to do, because we are missing out on some really potentially really amazing benefits for them. We have a lot of patients now on immunotherapies, metastatic patients who are living for a lot longer than we used to see them. And we have a number of small studies showing that what we eat during these treatments improves response rate. Here's just one of them from 2023, only 91 patients on immunotherapy for advanced melanoma. And the study group looked at patients and their adherence to a Mediterranean diet, which we know is a predominantly plant-based diet and low in red meat and processed meat. And they found that those who adhered more to the principles of a Mediterranean diet had a higher probability of response to treatment. You can see this straight line on this graph. And that suggests potentially an improvement in response for adjusting diet in patients undergoing these treatments. And the potential mechanism underlying this has been postulated to be the microbiome. And we do have a number of studies looking at the microbiome and measuring certain bacteria and the postbiotics, suggesting that more plant foods in the diet, which improve the distribution of microbes in the microbiome and improve the anti-inflammatory production of compounds such as short-chain fatty acids. So I wish we had time to go into that because that's really fascinating, but that's a really interesting area of research. Here's yet another study looking at plant-based diet and survival in patients with metastatic colorectal cancer. This is in an NCI-sponsored study, and it had a subgroup of patients who had done food frequency questionnaires at the initiation of their metastatic colorectal cancer treatment. Those who were having a more plant-based diet had a better survival, so we can improve outcomes by what we eat. I'm going to just touch very briefly on some dietary components because this comes up all the time in clinic. We all know about soy. This is the myth that will not go away. We have so many studies on soy, the benefits of soy in multiple settings. And in 2019, there were two very big studies. This is one, an umbrella review of systematic reviews and meta-analyses in humans. And this showed that there was a significant reduction in the number of cancers with soy intake. So it's associated with a reduced risk of getting cancer. And here is a second meta-analysis published in the same year, which looked at mortality compared to soy intake. And they found that increased soy intake was associated with reduced mortality from all cancers. And I pulled out one of the statistics here because the question comes up most in the context of breast cancer. But for every 5 grams per day intake, it was associated with a 12% reduction in breast cancer deaths. And we do have specific studies looking at breast cancer specifically in soy intake, and we can, I think, be reassured that we can tell our patients that there does seem to be a reduced risk of breast cancer recurrence and mortality after a diagnosis of cancer, both in hormone positive and hormone negative patients with increased intake of soy food. So I do recommend my patients have a couple of portions of soy every day and think about it like a treatment. The bad, well, we know processed and red meats are carcinogens. In 2015, the World Health Organization declared processed meat as a group 1 carcinogen means that we have the same strength of evidence that it causes bowel cancer as we do the strength of evidence that smoking causes lung cancer. And red meat was classified as a group 2A carcinogen, that it probably causes bowel cancer. And the two of them combined are estimated to cause about 21% of all our colorectal cancers, which accounts to about 5,000 new cases of colorectal cancer a year. And since then, it's been linked to a variety of different cancers as well. Interestingly, a poll in 2022 in Toronto showed that at least 50% of participants undertaking that survey were either unaware of this or skeptical. So again, we need to do a better job of this. And I do tell my patients that one of the best things that they can do is to drop processed meat and red meat from their diet. There's a number of reasons that these meats are carcinogenic. The nitrites and nitrates in them are converted to N-nitroso compounds in the gut, which are carcinogenic. They contain heme iron, which is pro-oxidant and causes DNA damage. They produce cancer-causing chemicals when we cook them. And they're also devoid of all the good things like fiber, antioxidants, and phytochemicals. So we're pushing out all the good stuff as well. And they're associated with a particular type of alkylating DNA damage that was shown by the Harvard group. I will mention specifically low carb diets just because there's so much interest in this from the social media and the influencers, but we do have some longer term data now showing that patients or people who are on a low carbohydrate diet, unfortunately, are at increased risk of mortality, overall mortality from cardiovascular disease, cerebrovascular disease, and cancer mortality. And I do have a number of patients who come in on this, and sometimes it's difficult to convince them otherwise. So moving on to exercise, we have some wonderful studies in exercise showing their benefits. We know that it benefits across the board in all body systems. When it comes to cancer, we have data supporting that physical activity reduces the risk of at least 13 different types of cancers. And it has a number of effects on the body which may be associated with this reduced risk. It helps maintain a healthful weight, reduces insulin resistance, insulin and IGF-1 levels. It reduces estrogen and other growth hormones in the body. It reduces inflammation and oxidative stress, boosts the immune system. It alters metabolism of bile acids. It can alter gene expression, it seems, as well, and it can prevent shortening of the telomeres. And the guidelines are, I think we all know here anyway, but it's at least 150 minutes of moderate intensity activity per week, or 75 minutes at least of vigorous intensity. And on a couple of times a week, we should be doing some strength building as well. In terms of cancer risk, the biggest bang for your buck comes from the aerobic activity. We also have a great guideline from ASCO supporting exercise during cancer treatments, that it can reduce treatment fatigue, preserve cardiorespiratory fitness, improve physical functioning and strength, and in some populations improve quality of life and reduce anxiety and depression. We have data that it can improve cognitive function for patients with breast cancer immediately after chemotherapy and 6 months afterwards. And we know chemo brain is such a big problem. We actually at Southlake have a specific course for brain fog because of this. We know that exercise can improve cancer survival. It's associated with improved survival in studies looking at breast cancer survivorship, colorectal cancer, and prostate cancer, and quite significantly, as well as reducing death from other causes. I'm going to highlight one of the studies in exercise because this was very unique. It came out last year. It was one of the most publicized studies looking at structured exercise after adjuvant chemotherapy for colon cancer. And this was a randomized control study. It's one of the first randomized phase 3 studies in oncology to show that a lifestyle intervention can improve cancer-specific outcomes. And I think it should be practice changing. And it took a long time to do. It took maybe 2 decades of work. It was one of the largest and longest RCTs conducted to test whether a lifestyle intervention could improve cancer outcomes. And it was a structured exercise program that patients were put on about 2 to 6 months after the completion of their chemotherapy. And it was a structured program over 3 years as the intervention group compared to just health education materials alone. And it translated into about 150 to 180 minutes per week of moderate intensity aerobic exercise, which was most commonly brisk walking. And there was a number of sessions that were mandatory in the first 6 months and got less frequent as the time went on. But these included behavioral support sessions and supervised education sessions, supervised exercise sessions. And they found that at 5 years after follow-up, the disease-free survival, which was their primary endpoint, there was a significant improvement in disease-free survival of the exercise group, about a 6% absolute improvement, translating into about a 28% improved disease-free survival risk. And at 8 years, there was about a 7% improvement absolute survival benefit for these patients. So it is like a treatment, and we should be recommending and supporting patients to do this. When I was at a presentation that they did, and I asked about other cancer types, and they said it just was not possible to do this long the study in every single cancer type. Really, we have enough evidence to support this in every cancer type already. We don't need more science, we just need action. Other lifestyle factors, we know that alcohol increases the risk of 7 different types of cancer. It's true for all kinds of alcohol, including red wine. There's a number of changes that alcohol takes in the body. It increases insulin and estrogen. It gets converted to acetaldehyde in the body, which causes direct DNA damage. It acts synergistically with smoking. It impacts negatively the microbiome and causes epigenetic changes. The Canadian Cancer Society says drinking any amount of alcohol raises your risk of developing cancer. So it really, truly is best not to drink alcohol when you're looking at cancer risk. And we know the updated alcohol guidelines now from, I think, 2024 say that really not more than 1 to 2 drinks of alcohol generally as a recommendation as well. Obesity, we know that obesity increases your risk of getting cancer, but it also increases your risk of cancer recurrence and mortality. In Canada, we have a big obesity problem. 30% of adults over the age of 18 in Canada are obese, 35% overweight. We have a similar problem in our adolescents, and it causes changes in our body. It increases estrogen and insulin-like growth factors. It causes low-grade inflammation, and we know that the lifestyle factors can help improve and help us maintain an ideal body weight. In terms of supplements, we generally don't recommend supplements for cancer risk reduction or even afterwards. And we'll see that in the guidelines shortly. There is this exception of vitamin D and cancer. This meta-analysis is from 2019 and showed that supplementation did actually reduce the risk of death from cancer by 13%. So I do encourage my patients to get their levels monitored. And the meta-analysis suggested that we should raise the level above 75 nanomoles per litre. And this translates to an intake of up to 2,000 a day, but can be much more depending on your levels. And certainly in Canada, many of us are deficient, as this audience knows already. In terms of comorbidities, I mentioned this because chronic disease is an overlooked risk factor for cancer. If you have a chronic disease, you will increase your risk of getting a cancer. If you have a cancer, you are at increased risk of dying from that cancer. And if you have a cancer and you haven't developed chronic diseases, you are increased risk of developing a chronic disease afterwards as well. And so addressing chronic diseases in our patients, whatever that is actually a way of reducing cancer risk as well. And we all know that the lifestyle behaviors we're talking about today positively impact that as well. Here's just one example of a study looking at this. This was published in 2021, looked at about 35,000 patients with a diagnosis of cancer from the UK Biobank. Patients were followed for 14 years, and they were assessed for 5 lifestyle factors: smoking, alcohol, sleep, healthy diet, and physical activity. And those who were following all of these positive lifestyle behaviors had a 44% reduction in the risk of cardiovascular disease, as well as a reduction in the risk of type 2 diabetes diagnosis after the diagnosis of cancer. And we see that each lifestyle factor has a benefit as well, incrementally so. And we know, of course, all the same lifestyle factors reduce the risk of second cancers too. I'm just going to skip over these next 3 slides, but I just wanted to showcase the ASCO guidelines associated with the Society of Integrative Oncology guidelines on specific symptoms that are so prevalent in our population who have a diagnosis of cancer. So there are recommendations for complementary therapies to manage cancer pain, to manage cancer fatigue, including exercise, CBT, mindfulness-based programs, etc., as well as recommendations to help anxiety and depression, which are so prevalent. Moving on to the guidelines, we have fantastic guidelines. This is from the World Cancer Research Fund and American Institute for Cancer Research. These are the guidelines to reduce risk, but also they say after a diagnosis of cancer, follow these recommendations if you can. So the recommendations are all what we would assume already: be a healthy weight, be physically active, eat a diet rich in whole grains, vegetables, fruits, and beans, limit your consumption of fast foods, limit your consumption of red meat and processed meat, limit consumption of sugar sweetened beverages, limit alcohol consumption, do not use supplements for cancer prevention. There is no evidence to support that. For mothers, breastfeed your baby if you can. And I love that they have this blog, top 20 tips for creating a plant-based diet. I recommend my patients look at that as well. So they fully endorsed a plant-based diet in their risk reduction. Their data was updated in 2025, which basically those recommendations that I just showed you from 2018, they all hold, and they've given some additional recommendations. So for in general, they've said prioritize those behaviors, as well as prioritize the behaviors of fruit and vegetable consumption, fiber-containing foods, maintaining a healthy weight, and being physically active. And they've said to restrict alcohol and red and processed meat. For overall additional specific considerations for breast cancer, they speak about avoiding any alcohol for breast cancer, because any amount will increase your risk for breast cancer. So that's different. And the other specific consideration for colorectal prevention was avoid processed meat completely, not just minimize it, but just avoid it completely. And also to increase calcium containing foods such as dairy in your diet. I take exception for that, and I'll come to that in the next slide. But they also mentioned including coffee, because coffee has been shown to reduce colorectal cancer risk and also improve survival in colorectal cancer in the setting of metastatic disease. So that was very interesting for me to see that. In terms of the dairy and colon cancer recommendation, I just want to say this is one of the studies that supports that. But interestingly, it says that higher calcium intake is associated with lower colorectal cancer, but this was observed regardless of the source of calcium. And we have to be careful, because there are multiple studies suggesting the increased risk of prostate cancer and breast cancer with dairy intake. So I would rather they would have said, not mention dairy specifically. We know that 70% of our population are lactose intolerant as well. It's not particularly inclusive. So that would be one area that I would perhaps change and make a bit more explicit. It doesn't have to be dairy. In terms of awareness and adherence, we have so many studies showing that if you adhere to the guidelines, you can reduce your incidence of cancer and you can reduce mortality from cancer. But knowledge and adherence is very low. We definitely need to do better with more public health campaigns. We have to educate our health professionals better, and we have to have systems level policy and environmental changes that make these lifestyle behaviors easier rather than relying on willpower to do this. Some wonderful resources that I share with my patients and colleagues. I'm sure you all know about the American College of Lifestyle Medicine and their 6 pillars of lifestyle medicine. They have wonderful patient-facing resources. Here is one of them, and they give actionable things to do for each of the 6 pillars of lifestyle: for nutrition, sleep, activity, avoidance of risky substances, social connectedness, and stress management. And if you are a member of the American College of Lifestyle Medicine, which I would really encourage people to be, it's not very expensive, you get access to additional resources such as this wonderful cancer toolkit, which is in 3 parts. So this first bit is all the pillars of lifestyle medicine, but just at the entry level. So it gives you easy things to do. Then you have the next level, which is wade into the shallow end and then dive all the way in. And I will be sharing my slides with Nivi and Stephanie, so anybody can access them as well to look at this in more detail. The other ones that I recommend to my patients are the Cancer Survivors Guide from the Physicians Committee for Responsible Medicine, and especially the second one, which is a free community guide to cancer nutrition on the Gilders Club Toronto site, which is associated with the free cookbook. And I really, really love this resource. We also have resources for patients who want to have a more deep dive into starting a plant-based lifestyle on our website, Plant-Based Canada website. The Canada Food Guide, of course, I'm sure you're all recommending this anyway. And just to highlight some wonderful resources for patients, obviously we in our practices don't have time to do everything for the patients, and it's wonderful to see these free community resources such as Wellspring, so many support systems there for them in multiple places around the country. Gilders Club do wonderful initiatives as well. And then Prehab RX, which is specifically for exercise, they do virtual personalized exercise on a one-to-one basis from a registered kinesiologist. And these ones patients can self-refer as well, so we don't need to do any additional work. In terms of educating ourselves, there's a wonderful course at University of Winchester. It's a 15-hour course on lifestyle medicine for cancer prevention and survivorship. American College of Lifestyle Medicine has loads of different courses to access, from very short to long. If you're a member, you get discounts on them, but you don't have to be a member to access these courses. It can be quite difficult to know how to approach these conversations with patients, especially in time-strapped settings. My sister and I wrote a short blog on how perhaps to approach this. This is just one way, of course, that we found helpful. I'm sure there's lots of other ways, and you guys are much better trained in the coaching mentality than oncologists are. So in summary, I hope I've shown you that diet and lifestyle have a major contributing role to play in cancer incidence. Diet and lifestyle interventions can have a significant impact on cancer outcomes in terms of quality of life during and after treatment, in terms of responding to treatments, in terms of survival outcomes. Our international guidelines support addressing these lifestyle factors, and we know, of course, that we have a duty of care to educate our patients and ourselves on this, and to advocate at all levels to advocate for this on a community level. Thank you so much.
Amazing. Thank you so much, Dr. Kassam, for such an insightful presentation. The data you shared on nutrition, physical activity, and other aspects of lifestyle really highlights the significant impact these interventions can have across the cancer journey, not just, prevention, during, and after. And it's really encouraging to see how much evidence-based information we can offer our patients. So thank you also for sharing all those really valuable resources. I know I will be referring to those and sharing with my patients here. So we can open. I know we don't have too much time, and I know people probably have to rush back to their clinic, but if anyone has questions, please feel free to ask or type it in the chat. And also there is an evaluation form again, so if you could fill that out, that'd be great. It's in the chat box. Yes, Dr. Martiniuk.
Hi, Dr. Kassam. Thank you so much for that talk. It was really, really great to see all the evidence, because I find that doctors are probably the hardest to convince, in fact. I'm hoping that
Yes.
at Wellspring, which is in our area, they already have been teaching this. Do you know if the Wellspring group in general, their dietitians are already teaching about plant-based nutrition?
That's a really good question. I would hope so, but I don't know. I find that the nutrition aspect is probably the least well taught, I have to say. I know that Gilders Club are all over plant-based nutrition. They have supper clubs, and of course that resource came from Gilders Club. But that's a really good question. I should look into that, because our patients are going there. I'm sorry, I don't know the answer to that question.
Yeah, I mean, I think that if they're not, it may be of high value for you to talk to them and give a presentation to their dietitians, because I think that might be the group that reaches more of our patients than individual physicians having the time to have this conversation, even if the physician is convinced that this is something that's important, which is sadly, I think, sometimes undervalued in terms of the strength of this data and the effect size. So, but the dietitians, at least for the cancer survivor population, might be the ones to deliver this information.
Absolutely, and I agree with you that the physicians are often the hardest to convince, but it also holds for many of our dietitians who, you know, we've all been trained in the old ways, and we're seeing this. So, for example, in Alberta, there's a group of dietitians that are promoting meat-based recipes. It's a cookbook just with meat-based recipes for patients undergoing cancer treatments and beyond. So you're right, there's a lot of education to do, and I say yes to any talk that is asked of me, but maybe I should be more proactive. So thank you for that prompt.
Thanks again.
Any other questions? Dr. Kassam, how do you incorporate, so if you see a patient, do you spend a little bit of time going over this and then give them resources? Like, do you have other tips for us and, you know, on short visits to kind of incorporate a little bit of a conversation?
Yeah, so I for many years had added on like 15 minutes for every new patient consult. Obviously, there are some exceptions. You can't do it for everybody. But I would talk about, I would ask their permission first. And but often they've already asked me. So the commonest question I get is actually about diet. And then it's, you know, what else can I do? And so I do go through the guideline. I do talk about a plant-based diet being predominantly plant-based. I never say to patients they should be vegan or 100%, but I say that the closer they can get to that, the more benefits they will have on multiple levels. And then I talk about all the initiatives we have in our cancer center, just highlight, we have mindfulness-based stress reduction program. So I use that to suggest these other resources that we've discussed as well. And that's kind of why I wrote that blog with my sister. And it just shows how I do it. But you know, we've been trying for many years to get that sort of health promotion education into all our patients. And I'm happy to say that, you know, having been trying to do this since 2018, we, as of last October, have developed this, what we call a Healthy Me program. It's a 45-minute PowerPoint presentation by our radiation therapists. So again, in terms of the sustainability, physicians can't do everything. And I'm just lucky I had a group of radiation therapists who are really interested in this. So they delivered this presentation and they answer all the questions that come from it at that 1-hour session. And it's a group-based session. We initially piloted a project 1-to-1. So patients at the last week of their radiation would get this 1-to-1 session. And the patients loved it. The therapists loved it because they felt like they were doing something really important. But the leadership didn't support the resources that were needed to do that on a 1-to-1 basis. So we actually have that now as a group session. So in October, we rolled it out to all our patients undergoing treatment for breast cancer, which is a significant portion of our patient load. And so they don't get, it's not an opt-in or opt-out thing. It's they get it on their schedule, whether they want to or not. It's just part of their treatment plan. So and then certainly if people say they don't want to go, do I have to go? Then they don't have to go. But very few patients are actually opting out of it. So that's just been rolled out to our prostate cancer patients now as well. So again, that's another big chunk of our patients. And then we're going to keep rolling out. We do seem at this moment to have support from our leadership, which is so key. You can't do anything without leadership. Yeah, so we're doing it very slowly because you know, and we've had great feedback. We have a an evaluation form, and people want people have said they're going to make changes for nutrition and exercise. That's the top 2, but they've also said they want more information on nutrition. That's the top 1 thing that they want more information on. So you know, we're meeting with our dietitians next week to see, and you know, pertinent to the previous question we just had. We'll see how that goes. Our dietitians have just been brought under the cancer centre. Previously, they were under the hospital, and I had not had great success in talking to them about plant-based nutrition in the previous years. But we have new people, new leadership as well. So fingers crossed for us that works out.
That's great. That sounds like a really great program. Thank you.
We're happy to share that presentation with anybody who wants it as well. So we just want to broaden it to as many people as we can.
Amazing. That would be great if you want to send it over. We will be putting these recordings up on the CCHOHD website. So, people have access, even those who couldn't make it today can go back there and review your presentation and slides. And yeah, so any resources you think would be helpful for us, please send them our way.
Lovely.
Dr. Martiniak, you had another question?
I do. Yeah, this is kind of a niche question because as we build out some primary care teams, I was curious about your evaluation for one-on-one dietitian with your cancer survivor population compared to the evaluations for group. Did they vary tremendously in terms of evaluation, whether people preferred one or the other?
So in terms of, so it's a radiation therapist who delivers this. So we didn't have a one-to-one on the dietitian. It was a radiation therapist delivering like the education session on all the lifestyle behaviors. So it's difficult, I guess it's difficult to compare because we got like overnight, we got 95%, like we love this. This was really useful. We're going to make changes on both, actually.
On both.
So on both. But the interesting thing is, of course, and we see a lot of this in the literature, that group work actually has additional benefits in that social connection. So that was really interesting. I don't know yet how we're going to tease that part out. But anecdotally, the therapists who are delivering this have noticed that there's a lot of interaction that does go on between the patients, and they kind of, they add to the answers and things. And the feeling is that this is going to be helpful being in the group setting.
Yeah, okay, that's great. Thanks.
Amazing. I think that's all the questions we have. Thank you again, Dr. Kassam. That was amazing. And I know we'll all be referring to these resources and incorporating more of this into our practice. Thanks again. Thanks everyone for joining, whoever's left. And we will send out the CME certificates, and we will post this recording on the CCHOHD website as well.
Wonderful. Thank you so much for the invitation.
Thank you. Bye.